kind of coffees on your shirt? OTG?
On the Grind Coffee,
Where's that?
Verde, San Marcos. They're like uh, they're not in San Antonio quite yet. There's one location.
Coffee shops are springing up, Doc.
What's that?
All these little... Dude, coffee costs a few cents to make.
Uh-huh.
Looks like the highest margin food. Starbucks sells it for $6. Probably costs 24 cents.
Do you like Dutch Bros?
Never had it. I rarely drink coffee outside of here.
Really?
Matter of fact, even when I'm going around town, I'll stop here first and get a cup.
Are you serious?
I like the taste of San Antonio and Texas pecan that we have.
What do you
Right,
make at
Doc? Delicious.
What do you make at home?
Nespresso.
Okay.
I just have Nespresso with sugar.
Yeah. Wow. Interesting.
Yeah, I don't really get into the coffee. But Nespresso makes beautiful flavors that are ready made.
They do. I've tried some of theirs. They're really good. What about you, Dr. Hernandez?
I just have a Mr. Coffee at home, and I order the McDonald's through Amazon.
Okay.
It's the medium roast.
That's
Medium
what.
roast.
That's.
It's not a French roast. French is like dark, real. Apparently, it's the burnt. French roast means it's kind of burnt,
Really?
over roasted. I like with it's a specific like burn taste.
That's disgusting.
That's French roast.
That's pretty nasty.
Italian log roast is a little more mild.
Yeah. Okay.
Medium.
Oh shoot. Hello. Dr. James in surgery. Just started the second case.
130 arm. No Renuvia under this?
Hey, Debbie. How are you?
Okay.
Just getting started.
Here you go. No, I'll get it at the end. I just want to make
Dr.
sure.
J's in surgery
Hey,
right
Art.
now. Getting started on some vaser before lipo. This patient is getting lipo 360 today. She's getting a removal of some breast implants and a replacement. She's had her breast implants for a little while now, so So she's just getting them replaced today with some new ones. She's also having a breast lift done today as well. So stay tuned for all of those procedures. We're on YouTube.
Will you be on at some point?
Yes, on it.
Okay, thank you.
Hey Terry, do you show the actual procedure? Yeah, we do. Sometimes. We don't ever show the procedure here on TikTok or on Instagram. However, this patient did consent to us showing it on YouTube. So we are doing exactly that. You can join us over there on our YouTube. You can join us by hitting the link tree and scrolling down to the bottom and looking for that YouTube icon. And then you can click on our YouTube link and it should take you right over to our page, and there you'll be able to see our live and join us. And over there we flip the camera, we show what's happening here in the OR. You can see Dr. J. If you have trouble finding it through the link tree, you can always search it up. Just type in Dr. Jeneby plastic surgery and it should take you right over to our page.
1.5 upward. 1.5 everywhere.
Let me know if you have any issues getting to our YouTube. It's going to be the same profile picture that you see here on this page, just on YouTube, so that may help. That may assist you a little bit. But again, this patient came to see Dr. J for Lipo 360, a removal of some breast implants and a replacement, so taking out some old implants and replacing them with some new implants. A breast lift. And so that's what's in store for Dr. J's second case. We'll be showing this patient's procedure in 2 segments, so we're just getting started now. Hey Sydney, yes, it is on YouTube, so feel free to join us. So like I said, we'll break it up into 2 segments. The first live, we'll show some liposuction going on patient's back that Dr. J is preparing for right now. Then we'll take a break, flip her over, and we'll be able to show the rest of we'll show the removal of those implants and the replacement. And then we'll show the rest of the life. Hey Sydney, yeah, what's up? Well, we just got started about 10 minutes ago. So before Dr. J comes in the room, she's usually being kind of, I guess you could say, she's being put to sleep a little beforehand in advance to make sure that she's fully sedated before Dr. J operates on her. So 20 minutes, give or take. Why? What's up, Sydney? And so that noise that you guys are hearing in the background is the vaser. So that just helps to make it easier when it comes time for liposuction, for that fat to be suctioned out. Kind of, I guess you could say, liquidizes it a bit, to explain it to y'all. So that way when Dr. J goes in with the candula, it's easy suction. And you guys are welcome to join us on YouTube so you can see that. And it's just going to be through that link tree, through the YouTube icon. It should take you right over there. Yeah, Sydney. So, as you can see, maybe you can't see that well. The patient's lying on her stomach right now. Dr. J is just doing vaser on her side and on her back. So, right now the vaser is being directed on the right side of her body. And so, like I said, that's just to prepare for liposuction. So, suctioning the fat. Let me know if you have any more questions. And then here in a moment, Dr. J will get started on the liposuction once the vaser's done. And then you see that tool that's laying there on the table. That is Renuvion, which helps to tighten the skin after a procedure, after liposuction. Can you use that fat for inside your breast? That's a great question. Yes, some people do ask for fat grafting to the breast. There's some surgeons that advise or don't advise that. There can be some risks, but um, it is possible. Sydney, yes. Is that something you're interested in? Um, quite, I mean, usually you'll see patients coming in that want volume. They want a lot more than fat grafting could give them, if that makes sense. And so the best way, um,
Especially if they're thin. Butt
if
implant.
they're thin, yeah.
You can't do BB on them. Can't really. Somebody with no fat. How do you do that?
Right. So it's usually recommended is just going with implants, but if you have the fat and you want a more natural, I guess, look, then sometimes fat grafting would be recommended. It just kind of depends on, what you're really wanting, what you're looking for. What is the tool in her back, that piece? That's just the tool to help guide the tool that's going inside her body so that like the incision stays open um, so that Dr. J can easily do the job. I have big boobs, just more round I want. Okay, gotcha. Yeah, well, have you already had your consultation, Sydney? Was that something that you brought up during your consultation at all? Because I think, we had a discussion fairly recently that you had a consultation, if I'm not mistaken. If you haven't, or if you're reconsidering, what you'd like to do as far as like implants or fat grafting, you should bring that up to your coordinator. But have you had your consultation yet? I don't remember if you actually did do a virtual or in person, because there can be arrangements made to like if that's something you're considering, that can definitely be an option for you if you want to ask about fat grafting. Just let me know. J's currently in surgery right now, for those of y'all that are joining us on our TikTok and whatnot. For those of y'all that can't see.
A what knot, Doc? Is that like a slip knot?
Oh my gosh.
What knot? Is that a sailboat knot? We're just kidding.
Okay.
So kidding.
Anyways.
Whatever.
Yeah, so like I mentioned, Dr. J is in surgery with the second patient of the day, so the second case. This would be Dr. J's last case, getting ready to start some liposuction. This patient came in for lipo 360, a removal of some implants and a replacement. So I'm gonna go ahead and remove those old implants for her and replace them with some brand new ones. And she's also came in for a lift today. Renuvion. So any questions, feel free to leave those down below. I'm gonna go ahead and pin a form that will pop up on your screen if you want to get in contact with us. If you guys have any inquiries, you can.
The fab salon. That like, you know, you need to apply for that if you want to do some things or, excuse me. And everybody normally fills it out just to see if they can qualify for some kind of either loan grant or some kind of money. Okay? I'm actually doing that today for it's very hard to fill out for. When I did it anyway. You did it for your kids? Yeah, open-ended questions, estimates of future salaries. It's really complicated. Really? Fab salon. 250, Mark.
Under or over the muscle. Hey, kids. So.
Yeah, she said she has to do that today.
Dr. J will say under the muscle. We've done a lot of videos about like this or that breast edition. And Dr. J has said under the muscle, it gives a more natural appearance. And the implant isn't sitting right below the skin. So it's not like poking out or giving any reason for concern. Why is he cutting a hair saw? Made in Malibu. Sorry, that just made me laugh. That's not a saw. It is our candela. It is our power assisted lipo. It helps to suction the fat. Basically, it works like a pump, sort of. If you think about it, just sectioning that fat. Yes, maiden. Yes. So it's just suctioning the fat. Our liposuction, power assisted lipo. Yeah, it looks scary. I know exactly what you're talking about. But it's just pretty loud, and it does sound kind of like a saw now that I think about it. But that is what you hear in the background. It's very loud. Yeah. This patient came to see Dr. J for lipo 360. Dr. J will go in with Renuvion. This patient is also getting a removal of her implants, and then a replacement, and then a breast lift. And then there will be some more lipo in various areas. She's also getting a hernia repair. It works. If you need it, it's worth it. Absolutely. You might be a little sore after the liposuction just because, you know, it is something that's going into your body, and I guess you could say poking, you know, like around the skin. And it's like only on the top layer, you know, sectioning the fat, but still it's like poking around in there. And so obviously you're gonna feel really sore, but it is worth it for patients who just want to look a little bit more snatched, but they don't want to do something like a tummy tuck or anything like that, like where they have to surgically remove anything. Lipo 360 is what's recommended, especially for those who just have like that stubborn fat and they just can't seem to get rid of it through exercise or dieting. Um, Lipo 360 is a great alternative, or not an alternative, but a great assist in that, and improving your appearance and your, I guess, trying to achieve that summer look. But yeah, let me know if you have any more questions. We'll break this patient's
200.
procedures
Lower
into
back,
2
or
segments.
posterior
So
flank.
we're gonna go live for a few minutes here. As you can see, like just to do some lipo, then we'll take a little bit of a break so that the patient can get flipped over, and then from there we'll resume. So Dr. J will resume liposuction. We'll do the breast augmentation, while removing the implant first, and then adding the new ones,
Airplanes were meeting
and then the breast lift. And we will also, we're also showing this on YouTube as well, so you can join us over there. On YouTube, we flip the camera so that way you guys can see what's happening in the OR with Dr. J. You can see the procedure, the patient, and where she's and where they're having the procedure done.
Can you burp that thing, Doc? Pull it off and on again? I lost some suction. It's like it's clogged somewhere. Take it off and on. If you give me suction.
Oh! Huh.
Sort of a lot. Maybe here, maybe? Coming from here, are you getting suction to the orange? Go with your thumb? No. Something came off? There's no suction at all.
Do you want me to call a nurse?
And I'll put that back on. Weird, right? Oh, that thing came off. Okay, let's try that. yet. No. We'll call up. We have to go to the other, try to go to the other device. Yeah, just take that off. What's going on with that side?
The steel here is not.
Yeah.
Sorry
Better
about that.
Something happened to that suction. Yep, back on.
As you guys can hear, Dr. J is currently doing some liposuction right now on this patient. This patient came to see Dr. J for lipo 360, a removal of some breast implants and a replacement, so getting the old ones that she's had in for a couple years now, replaced with some new ones. Just getting a breast lift done, a hernia repair. Let me know if you guys have any questions. We're going to break up this patient's procedure into 2 segments like I mentioned earlier. So we'll go live for a little while here. We've already been on for about 30 minutes. So we'll do some liposuction showing that right now. And then we will take a break so that the patient can be flipped over. Dr. J will continue with the lipo and we'll be able to show this patient's removal of those implants and the replacement along with the breast lift. So any questions, you guys can feel free to comment them here, comment them privately, like DMing us, or reaching out to the number that's provided through our profile. Hey Stephanie, what's the price for tummy tuck and BBL? Great question, Stephanie. That is definitely going to vary on, for example, for the tummy tuck, like how much you want removed. For the BBL, how much is that? Dr. J or whoever will have to basically section out and how much you want put into your butt. But you can expect upwards of 10 grand. But if you want more accurate pricing information, I'd recommend filling out this get a quote form. It's free, it takes like 3 seconds to fill out. It's just your information that you put down and somebody will get back to you with an accurate quote. They'll quote you for the procedures that you're interested in having done. And those are the numbers you can expect to pay or consider. So let me know, Stephanie, if you have any more questions about that. Again, it's just going to vary on what exactly you and Dr. J decide on what's going to happen during your surgery. There might be some add-ons like Renuvion that you want done, or Morpheus, or whatnot. So yeah, just fill out that form and they will be able, whoever reaches out to you, they'll be able to give you the most accurate estimation. Do you have a bunch of scars with this, Cindy? No. You don't have a bunch of scars. With it just being lipo, like I mentioned, you might be very sore, very, 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 very light bruising in areas because, again, like it is poking, it is underneath that skin, so you might notice some bruising. It might be very sore. But that's just kind of a given. There's going to be, like where the incisions are made, they're very small, they're not super invasive. So it's not like a lot to...
Remember, this has to go to the front too. What happened with this? It wasn't, we were having trouble, so we troubleshooted it and pulled itself off.
Hey Marlene, please fill out this form that we have pinned here on your screen, or visit our profile and hit our Get a Quote form. From there, we'll be able to give you more info. Essentially, Marlene, let me know if you have any more questions on that. We're actually going to wrap it up. Through that phone number, through that form, someone will reply back to you. And when they do, I would ask about our specials, different specials we have going on. As it is the last day of the month, you can take advantage of what we have. And we are going to take a break. Dr. J is going to finish off with some Renuvion. We'll take a break, and then we'll come back when she's flipped.
I just switched it.
So I'm going to look through all of those forms that were just submitted, and then I will get back to all of y'all. Tune back in for our next live. It should happen in half an hour about. So stick around for that, and we'll see y'all in a few minutes.